And it turns out by 2035, we should have 12 million people with Parkinson's.
I walk the streets of New York and I'm like, Parkinson. And when I see them, I get pissed off because it's a terrible disease and I think it's largely preventable.
We're all like cesspools, and the question that becomes is, you can do all these things and it'll reduce your exposures. You don't drink out of plastic bottles, filter your water, have an air filter, eat organic when you can. These are all things that you can do. Have better skincare products, household products. That's easy. The hard part is, okay, you've got someone to walk in your office with Parkinson's disease who's been exposed to chemicals, exposed to heavy metals. What do you do?
So first of all, we're all cesspools and we're all victims. Right.
Yeah,
we
not
are
that's
all
your fault.
Yeah. No, but some people take it the
I don't
wrong
mean
way.
that.
I know you don't, but like we're all victims,
Thank
right?
you.
These are unnecessary. These are involuntary.
Yeah.
Right. These are involuntary.
If you're drinking like a 6-pack of soda every day, you know what you're doing.
Yeah.
But like here, we're just.
But the Marines at Camp Lejeune didn't know that they were drinking
And the burn
carcinogens
pits
and the
and-
burn
oh my
pits
God.
and Agent Orange, and the list goes on and on.
Yeah.
And people who work with these dry and cleaning chemicals likely don't know. Many of the farmers don't know that the pesticides are linked to Parkinson's. The vast majority don't. So the first thing you need to do is stop getting exposed. If you're a smoker and you get diagnosed with lung cancer, what's the first thing the doctor's going to tell you to do?
Stop smoking.
Stop smoking. But if you're a farmer and you're coming with
Stop
Parkinson's,
farming.
I mean, like, do we even?
I have a patient with ALS who's a farmer, and he, it's heartbreaking because it's one of those neurological diseases caused by toxins.
And sometimes you find it early enough, we could maybe stop it.
Yeah, no, I stopped it and reversed it with him.
So there are ways that we can do this. So if you're working with if you have Parkinson's, we give you in the book, the Parkinson's 25 actions that can reduce your risk. If you don't have the disease, if you're one of 330 million Americans who don't have the disease, we'll give you 25 actions to reduce your risk of ever getting Parkinson's disease, ever getting it. If you're not exposed to these chemicals, you are highly unlikely to ever develop Parkinson's disease. And if you already have the disease, they might slow the rate of progression. So I'll give you a concrete example. They looked at people who already had Parkinson's disease, and they looked at people who lived in highly polluted areas of the country and those who lived in low polluted areas. People who lived in highly polluted areas had an increased risk of being hospitalized due to their Parkinson's disease if they lived in areas with high air pollution.
Yeah.
So you got an air purifier in the corner. We can get an air purifier when you're driving through
I put that in
traffic.
there just for you guys.
Thank you.
When you're driving through Lincoln Tunnel, roll up your window.
Yeah. Put the recirculation on.
Exactly. Recirculate the air. If you happen to live near fields that are being sprayed with pesticides, close your windows. I mean, there are lots and lots of things that we can do.
I hold my breath while I fill up my gas tank. I literally hold my breath.
But we need to create a world where we don't have to take all these actions. So what are things that we can do in our community? Can we stop spraying pesticides on kids' schools and playgrounds?
That would be a good idea.
Right? And we wonder why 1 in 31 children get autism, yet we spray nerve toxins on their schools and playgrounds.
Yeah, what did TX actually say when he heard of the theory of evolution? How stupid not to have thought of that.
So there are lots of things in our communities that we can do. And what are some of these societal actions that we need to do? And I'll let you talk about additional ways to address it.
Well, so the other thing is that
awareness is important.
Yeah. If you're a smoker, what's the first thing you do? If you get lung cancer or whatever, stop smoking, right? So this idea that, you once you have the disease, okay, or once you have the diagnosis, that you stop, with these things is sort of another myth that needs to be busted. It is the way that you live. You even talked about some of the people that you see within the functional medicine, in that paradigm, you're thinking about how can we help people to live better, right?
Yeah.
So the Global Burden of Disease Study, you told us something.
Just for those who don't know, that's like 195 countries, a study of chronic illnesses all across the world. It was a large epidemiological study, one of the best ever done, and it gave us a lot of information about who's suffering from what where. So just
100%.
so people know what it is.
Yeah, so 100%. So back in 2012, I had written this book, 2013 or something, I can't remember now, but we wrote a book called 10 Secrets to a Happier Life with Parkinson, and it kind of became this runaway bestseller, but it was like 10 simple things that you do, right? And in the prologue of the book, I made either the unfortunate or the fortunate choice of 2 words called the Parkinson pandemic, and came under a lot of scrutiny from colleagues and everything, and rightly so, right? I'm a scientist. I should be able to take.
Turns out you were prescient.
Well, so you have to put it forward. You have to, these things need data. So then we write the book Ending Parkinson's Disease in 2020. We have the first cut of that global burden of disease data, and guess what? Ray is better at math than me. He crunches all the numbers, and it turns out by 2035, we should have 12 million people with Parkinson's, which is like, wow, growing faster than Alzheimer's.
So like percentage-wise, how much of an increase in that is like in 50 years?
And just in 1990, it's estimated that 2.8 million people have the disease. And I'll steal a little Michael's punchline. In 2021, they estimated that 11.8 million. A quadrupling.
Adjusted for population too?
So even if you adjust for population growth, right? Population growth hasn't quadrupled between 1990 and
No,
2020.
so it's still 2 or 3 or plus times the amount, which is in just the last
30 years.
After
So
I
since
graduated
medical school.
Yeah,
Right?
but you're supposed
Since
to
your
have
medical
12,
school.
12 million mark in 2035. How many do you have today? 2025, 11.8 according
You already
to
got to 12 million 15 years before we thought it was going to happen. And when you went to medical school, Parkinson's was there, but it wasn't like everywhere.
Oh, no.
Not
I mean,
everyone
I've seen so many people with it.
But now, like anyone over 50, if you're over 50, you have friends, you have family members, our inboxes are like, it doesn't stop. I walk the streets of New York and I'm like, Parkinson. And when I see them, I get pissed off.
Why?
Because it's a terrible disease and I think it's largely preventable.
Yeah.
Right? Suffering is part of the human condition, right? You write about this. But preventable, needless suffering, really?
Yeah, I agree. I think that's our goal. I mean, for me, my life goal is to prevent needless suffering because, we can't change everything. We're officially in the thick of holiday season. And while everyone's rushing around doing their shopping, I want you to think about something different this year. What if instead of just buying stuff, you gave the gift of health to yourself and the people you love? Because let's be honest, health is the foundation of everything. Now, I'm excited to share something we've never done before. We're offering 30% off the 10-day detox, founding member rates for the Hyman Hive, and 20% off all our supplement stacks, foundational sleep, fertility, immune health, heart health, and lots more. If you're ready to reset your own health, or you want to give someone you care about the tools to feel better, now is the time. And this sale runs just through December 2nd, so don't miss it. So just for the audience, what are the air, food, and water things that they can do to reduce their exposures?
So we give you the 25 recommendations in the book. I'm going to read you number 1. Wash your produce, even your organic ones. Mark, you know this better than we do. Pesticides have contaminated our food supply. Remnants of pesticides are found in 20% of common foods. Organic produce, dairy products, and meat can reduce exposure, but can still have unsafe residues of pesticides. So wash your produce at least with water and consider simple vegetable washes, vinegar, or salt solutions too. When the government measures the pesticide residues on a piece of fruit, they do that after they've held it under cold water for 15 to 20 seconds. If that's what the government's doing, think about what you should do. I'll do the second one. I'll give the last one to Michael. Number 9, use a water filter. A simple carbon filter, water filter, widely available in supermarkets, can reduce exposure to pesticides, volatile organic chemicals like trichloroethylene, and other chemicals that may be in your water. These carbon filters can be installed for the whole house at the point of entry or at the point of use, such as faucets or even water pitcher. My colleague at Atria Health and Research Institute, Robert Kachko, will tell you reverse osmosis is even better. And I'll let Michael maybe take number 10.
Yeah. So,
I do reverse osmosis.
In terms of your air, number 10 is consider air purifiers. They're an easy, effective way to lower your risk of disease from indoor air pollution. Air purifiers do a range in cost. They can be as little as $10, as high as $1,000. I'm sure the one Mark has us breathing here has got to be the $1,000 one.
No, it's not actually. It's $300.
All right, $300. And require periodic cleanings. And remember, they need filter changes and may need to be installed in multiple places depending on the size of the home, school, or workplace. Be sure to use air purifiers that have carbon filters. They're designed to remove the volatile organic chemicals, VOCs, like trichloroethylate, which you all know from dry cleaning story and everything is so important in Parkinson.
This is great. So these are simple things that people can do every day. I have an air filter in my bedroom, and in the place I spend the most time, I have a reverse osmosis water filter. I think those are the two most simple things you can do at home. Plus, go to ewg.org and make sure you clean out all your crappy household cleaning products and your skincare products, and you'll get like 80% of the way there.
And a shout out to Ken Cook, the outstanding leader of the environmental working group. He and his team are helping us understand what are the role of these chemicals in our environment and our health and how to get rid of them.
We could talk about, the role of toxins for a long time, but, we kind of covered a lot of the sources, but I kind of want to spend a little time on on people who actually have Parkinson's and who are struggling. There's been really shitty drug development in this disease. There is some really exciting new surgical interventions, the deep brain stimulation. Dr. Machado at Cleveland Clinic, who I worked with, was one of the pioneers in this, a neurosurgeon. And
this guy's one of the pioneers right here.
Yeah. You obviously, I read your work, has been very involved in this, and that's a huge boon. It's a big win, but it doesn't address it's just like a downstream sort of better mousetrap to fix the problem, but it's actually, we still have the mice. So I would love to hear from your perspective from like a diet, lifestyle, supplement, detoxification, what you guys know. I would love to sort of unpack what people can do. And can in the answering of that, can you actually reverse it or stop it? Because right now there's like clinical trials, for example, in Alzheimer's, like the finger trial, the pointer trial, Richard Isaacson's work, where they're showing not just slowing down of the disease, but actually reversing it with intensive lifestyle therapy and risk factor management. So do we see that in Parkinson's? Have you seen that in Parkinson's? You've guys like Del Bredesen, who people think may be a little bit off the rails, but honestly, he's not, reversing Alzheimer's. I just talked to one of my patients 2 days ago who I've been treating for 2 years, and she was diagnosed with Alzheimer's, and now she's better and back to work.
Let's unpack a little bit, and let's just start with sort of, a few P's. So we need to change the way that we practice when we interact with folks with Parkinson. It needs to be practical, proactive, and preventative. Mm-hmm. Okay, we need to be thinking of those 3 P's when we're interacting. And I know
you might forget one: personalized.
And personal. We can keep going with P's too. And but absolutely. Although I will say, just like in general, how people make things a little too cliche. Sometimes people say personalized, and that's going to cure everything. I say, well, what does that mean? Like,
well, the reason I say that is because if you have a diagnosis of Parkinson's, it doesn't mean you know what's really wrong with you. Like I always say, if you know the name of the disease, it doesn't mean you know what's wrong with you. You don't know the cause. You know the name of the symptoms, which can have many causes.
So Parkinson's disease, here's another myth. It's not Parkinson's disease. It's Parkinson's disease is. Yeah. Right? There are multiple causes. There are multiple syndromes. Yeah. No 2 people look alike. And I remember sitting next to Davis Finney in the White House, having a nice discussion with him. And, he said, when you have Parkinson's, you got to make every day your best day. That always stuck with me. And then when I made my comments, I said, I think Parkinson's is probably the most complex disease in clinical medicine. And I don't mean to insult other people in different diseases, but think about it. Dozens and dozens of motor, tremor, stiffness, slowness, non-motor symptoms, anxiety, depression, constipation, sleep, cognition, right? So you got all of those things, right? Plus you've got this miracle drug, dopamine. You give people dopamine, they wake up, right? And then of course there are fluctuations later. Then you've got, as you mentioned, deep brain stimulation. You've got dozens of different medications. Oh, and by the way, it changes over time. People wear off. They get these dance-like movements. It is a super complex disease, okay? So when you take all of that, we need a different paradigm to care. And so unpacking the first part of your question is, we're doing it wrong, Mark. Like we're caring for people wrong. So when we have HIV, we're able to create navigators. We're able to check people's viral levels. We're able to get people, listen to this, mind-blowing for people. We can get really expensive cocktails of drugs for people all over the world who have HIV.
I can't get L-Dopa for
And you
pennies.
Can't get L-Dopa, pennies on the dollar. So we call for that as a bold action in the book. 100% of people on this earth, on planet, if anybody's listening, we need to
And L-Dopa is the drug that's the mainstay for Parkinson's treatment that increases dopamine, which is what gets depleted in the brain when you have Parkinson's.
And it's a game changer, right? And so super important to think about that. And cancer, we do better in the way that we bring together the right teams. So thinking about this, we used to say the person with the disease or the patient is the sun, and we revolve around the patient. I'm like the broken record of saying this for 25 years at the institute I work at called the Fixel. And now we've expanded that to be the Parkinson universe. And let me just explain that for people listening a little bit. So of course, the person with disease is the sun, and we should all orbit around them. But what's the closest planet to the sun? Mercury. Mercury's your caregiver. Gets a little hot being the caregiver on both sides because you're in between that and then all the other planets, which are all these different specialists. You might need, a neurosurgeon, a neurologist, a psychiatrist. Mental health is huge in this disease and a problem throughout the world, not just in the United States. All the rehabilitation specialists, PTOT, speech, swallow, et cetera. So you need all of these people orbiting at different areas. And then you've got Mercury, the caregiver, in the middle. Got to take care of the caregiver. Okay. More men than women get Parkinson, but guess what? When a woman gets Parkinson, they don't do as well as men. And the reason is the caregiver and the care partner. So we should be challenging men. I'm sorry, men, all the men that come to my clinic. I challenge all of you, care better for your friend. You need to step up. The data says you need to step up, okay? And then Pluto is the almost planet. That stigma, 25% of people hide their diagnosis with Parkinson disease, unacceptable. So and then what else, Mark? So the stars are all the support groups, right? And then the all the satellites are the sensors. We have all these great sensors. I got some of them on. I think you've got sensors too, and watches and rings and all these things, right? That can help us with sleep and exercise and making sure we're doing all those things. Bringing telemedicine. Ray is an absolute pioneer in bringing care to the home for Parkinson.
Well, I thought that was an interesting thing you said in your book because, it annoys me to no end that the body doesn't change when you move from New Jersey to New York or from California to Nevada, but your license does, and you can't treat a patient in another state, which is the most stupid thing.
Yeah.
In Europe, if you're a doctor in any country, you can treat a doctor anywhere else. We uplifted those restrictions during COVID, and then we put them back in, and it's crazy.
And who loses?
The medical boards.
But the patients lose, right?
Patients lose, yeah. But
Right.
it's just a money grab because every state has a licensing board, and they're all making millions.
So we should make it so that any patient, and any Medicare beneficiary, any patient can receive care from any clinician that they need to.
Absolutely.
So thank you for saying that out loud. Like sometimes we think it, but we don't say it. So thank you for saying it out loud.
I'm working on a telehealth bill also in Congress, so we're on that.
So maybe for the last, 2 decades with Parkinson Foundation, we may have spent a lot of hours advocating so that your care is defined by where your physician or healthcare provider is, not where the person with disease is. It's a very simple concept that we just can't seem to get. And then we did a red card campaign in our last book, Ending Parkinson. We actually took over the White House and sent thousands and thousands, like 20,000 plus cards. One of the things we called for was just this: watch out, the COVID restrictions on telemedicine were lifted. It's going to go away. Pay attention. We need that. And so it was one of the 3 things that we asked for.
But is there more? Because what you're talking about are sort of structural changes in the care delivery model.
Yeah.
What I'm really trying to get at here is like doctor-patient, like what are the therapeutic interventions other than just the social support and the structure and the care coordination, all the things you're talking about, which are really important. But like, I'm trying to get to the granular level of like, if someone's listening with Parkinson's or someone in their family has Parkinson's, like, what do I do? Is there a way to slow this, stop it, reverse it?
Yeah. So the practical, now you're to the P of practical, right? Let's get practical, right? No, that's good. All right. So we think about practical, right? And the practical advice now that we should be giving that most people don't is, guess what? When you take dopamine, the most common drug for Parkinson, very important, still the best drug we have. Ray likes to say, what a travesty that here we are 50 years after and it's still our best drug in the armamentarium, right? That should be unacceptable too. But having said that, dopamine depletes cofactors in your blood. And so your vitamin B6 may go down, your homocysteine may go up, other things that might put you at risk for dementia and other things. So guess what? From a very practical standpoint, you need to be on at least a general multivitamin. I call it like a Centrum equivalent because most people, I don't favor Centrum over any other company, but
don't take the blue pill.
Right. I'm not doing that, but
you don't want to take pills with dyes in them and titanium and
so no question about that. But
you're just adding more shit.
But fundamentally, thank you for saying that. Again, you get to say the things.
Talking to the expert here, man.
I know. Mark gets to say things out loud that we can't. But from a practical standpoint, you send people to the shelf and you say you want to look for a good multivitamin because this is going to be super important, right? And then when you're going to your general doctor, you want to have them check vitamin levels on you at your regular thing. They're checking. We're so preventative in cardiology, Mark. Why are we not in neurology, right? It's ridiculous, right? vitamin E levels are low, in Parkinson, right? Vitamin D levels are low, right? And then it's a double-edged sword with vitamin D because we should be telling folks it's twice the risk. Did you know that? Twice the risk of melanoma and Parkinson's disease. You sweat different, you smell different. Joy Milne was the famous UK person who could smell Parkinson's disease. And then they said, you talked about quack. They said she's a quack. They put her to the test. Sure enough, there's a smell.
Yeah.
So you sweat differently. Remember, it's a full body disease. It's in the skin and everything. And you're not as well protected against the sun. And so we need to tell people about that. And of course, practically speaking, you can get seborrhea and other things with skin, twice the risk of osteoporosis. Are you getting regular bone scans? I know this sounds like and we wrote the book 10 Secrets. You think everybody knows this, but they don't, 2 times the risk of that. So we need to pay attention to those things. And then in addition, as we're seeing folks kind of along the way, I know, and Ray may want to talk about this, we need to shift our discussions with them to sort of include the why, figuring out what is your real history. And I was kind of jealous when you said in functional medicine, we always start the visit with the person. And Ray and I have taken care of thousands of people with Parkinson. We didn't always do this. You always start the visit from the beginning. It's like, Mel Brooks in History of the World. No, the beginning of time, right? You start from the beginning and you want to know what that story is.
If you love that last video, you're going to love the next one. Check it out here.